Good afternoon, and thank you for joining us. We're here today because Black women are still not receiving the care they need and deserve before, during, and after pregnancy. We are here today because President Trump gutted Medicaid, which covers nearly half of Black births in our country. President Trump and his incompetent health secretary are making health care more expensive and out of reach for hardworking Americans. We are here today because racism is still alive and prevalent in our healthcare system. My constituent, Mercedes Wells, a Black woman, was discharged from a hospital while in active labor. Minutes later, she gave birth on the side of the road in her truck with only her husband to help. Mercedes told me there wasn't a single nurse or a doctor of color on the hospital floor. They all watched in silence as a nurse wheeled her outside of the hospital, crying in pain. Mercedes told me she wants to be a vessel for change, so I introduced the Wells Act. It would require a safe labor discharge plan and make healthcare providers think twice before discharging a pregnant patient. Is there clinical justification for discharge? Is there another hospital or birthing center on the way home? Is there reliable transportation? These are all questions that were never considered when Mercedes was discharged. The Wells Act also implements a racial bias training because it is clear that our healthcare system is broken, and it has been for a long time. For nearly a decade in Congress, I've worked to improve Black maternal health outcomes. I introduced the first comprehensive legislative package to address maternal health called the Mamas Act, and successfully extended Medicaid postpartum coverage from 60 days to a year.
Yes.
I brought the issue of maternal mortality to Congress because one day I got a call from a constituent who's a friend. She said, "I have a story to tell you." Her friend's daughter-in-law went to the hospital for a routine C-section and gave birth to a beautiful baby, but she did not survive to raise her child. Her family begged for help, but medical providers did nothing as she bled internally for hours. Her name was Kara. Kara's husband decided to turn pain into action. To this day, just after 10 years to the exact day when Kara died, he carries her story forward so no other Black woman or family suffers. I've been so grateful for his partnership in Congress as we continue to push for the care Black moms deserve. I'd like to introduce Kara's husband, founder of For Kara for Moms, Charles Johnson.
Yes.
Okay. Thank you so much. Can everybody hear me?
Yes.
First of all, happy Black Maternal Health Week. Happy Black Maternal Health Week. And first of all, I want to thank you so much to my shero, Congresswomen Robin Kelly. Thank you so much to everybody else that has joined us today. Thank you for those of you all who have written letters in support of this act. I'm going to be brief this afternoon, but my heart is really full. And as I was talking to the Congresswoman, she was, and honestly, this is just on my heart to share, she was talking about my story and the power of Kira's story. And so I'm here to share that story with you about a woman who thought that she had done everything right.
Yes.
A woman that was healthy, vibrant, who had a husband that loved her, who sought out Kira, what she thought was one of the best hospitals in the country. She went in for what she wanted and expected to be the happiest day of her lives, and she walked directly into a nightmare. For 10 hours, she was allowed to bleed internally while myself and my family begged and pled for them to see her, to validate her pain. But our cries for help fell on deaf ears. And after 10 hours of allowing her to bleed internally, they finally took her back to surgery, and it was far too late. And I'm always unapologetic about the fact that when I walked in that hospital that day, the thought that my wife would not walk out to raise her sons had never crossed my mind.
Right.
And I tell you that story because you hear the data, you hear the statistics, but what I'm here to share with you, there's no data point that can quantify what it's like to tell an 18-month-old child that his mommy's never coming home.
Yeah.
There's no algorithm that can try and compute how hard it is to explain to a son that's never known his mother just how amazing she was.
Yeah.
And so I share Kira's story. But I also say boldly and definitively, I tell you about Mercedes Wells and her husband, who once again walked into a hospital for what they expected to be the happiest day of their lives and were met with everything except humanity. And so I'm so proud to stand here on behalf of the Wells family, on behalf of the thousands and tens of thousands of families that have been impacted by near misses and traumatic birthing experiences, and mothers that have made that ultimate sacrifice just trying to give the gift of life. And so there's so much power, even though it makes us angry, there's so much power in the story of Mercedes Wells. But I want to tell you one last story. And the story I want to tell you is about a future where every single mother, regardless of what their last name is, what their immigration status is, who they love, what the color of their skin is, every one of these mothers receives the safe, amazing, beautiful, dignified birthing experience that they deserve.
That's right.
And it's because of all of you and your commitment to this, that is the story that we will be telling our children sooner than later. Thank you so much.
Wow, thank you for sharing. I'd now like to introduce the chair of the Congressional Black Caucus and one of the co-chairs of the Caucus on Black Women and Girls, Congresswoman Yvette Clarke.
Thank you so much, Congresswoman Kelly. To Charles Johnson, thank you so much for seeing it not robbery to go on this crusade for dignity and for the health of our mothers. As has already been stated, I am Congresswoman Yvette Clarke, and I proudly represent New York's 9th Congressional District, located in Brooklyn, New York, and I am chair of the Congressional Black Caucus. I want to sing the praises of my colleague, Congresswoman Robin Kelly, who came to this Congress on a mission around Black maternal health that she has never yielded from. As chair of the Congressional Black Caucus Health Brain Trust, she continues to lift up this issue, mobilize members across party lines, and I want to thank her for convening us during Black Maternal Health Week. I am grateful to stand alongside my colleagues, all these advocates and health leaders who are committed to protecting Black mothers and families across this nation. We are gathered today because the state of Black maternal health in America is not just a public health issue, it is a moral crisis. We know the facts. In the United States, Black women are still 3 times more likely to die from pregnancy-related causes than white women. Too many of these deaths are preventable. Too many families are left grieving, and too many warnings have gone unheard. Behind every statistic is a name, a story, a family forever changed. We lift up Kara Johnson, and so many others whose lives should not have been lost. Their stories demand more than sympathy, they demand action. And that's why the work led by Congresswoman Kelly and the CBC Health Brain Trust is so critical. Expanding postpartum Medicaid coverage to a full year was a major step forward, but we know more needs to be done. We must continue to invest in community-based care, diversify maternal health, the maternal health workforce, address implicit bias in our healthcare system, and ensure that every woman, no matter her zip code, has access to quality, affordable care. But let me be clear, at a time when we should be building on progress, we are instead facing pervasive attacks on healthcare that threaten to take us backward. Efforts to dismantle healthcare undermine reproductive health services and strip away critical protections that will disproportionately harm Black women around our nation. These attacks are part of a broader pattern of neglect and disregard of our health and our lives. The Congressional Black Caucus will not stand by while hard-fought gains are rolled back. We will continue to fight for policies that center equity, protect access, and save lives. Black maternal health is about more than health care. It's about justice. It's about dignity. It is about whether this country is willing to value black women the way we deserve to be valued. So today, we stand united with advocates, with families, and with the communities to say enough is enough. We will keep pushing, we will keep organizing, and we will not stop until black mothers are safe, supported, and able to thrive before, during, and after their pregnancies. With that, I yield back, but I'm going to introduce the gentlelady from Michigan, another fighter for justice, for maternal health, Congresswoman Rashida Talib.
Thank you so much to our incredible Black Caucus chairwoman, but also our incredible leader on Black maternal health, Congresswoman Robin Kelly. Thank you so much. As she knows, and we've been working really hard together at the Congressional Mamas Caucus and working and making sure that we humanize, again, the crisis that we have, the Black maternal health crisis that we have. As people walk through the halls right now of all the congressional offices here on Capitol Hill, you're going to see images of real mothers. Of black mothers, so many different ages, you can see it, and as you can go through there, you will see the beautiful artist work of Amari, and Amari lost his partner, Miss Gibson, giving birth, and Charmaine was healthy before she walked in, and she just wasn't believed. That's the story that her mother continues to tell, and her partner continues to tell, is she wasn't believed. And one of the things that is really hard here is trying to get our colleagues to move with the urgency that is needed on Black maternal health crisis beyond this week of an understanding. We want them to go beyond the social media posts and the tweets. We want them to support the bills that Congresswoman Robin Kelly and many of us are pushing forward. You know, many of the black mothers I speak to that know someone, even immigrant mothers that I speak to, they will tell you over and over again, we're tired of task forces being created and being studied. We want actual investment in creating our own birthing centers, our own places to be safe when we give birth. You know, even at the images as you go through and you see the stories, it's all very different, but all similar in, again, the fact that they didn't feel seen or heard by our healthcare system. Literally ignored, dismissed. When I saw the story of a mother trying to give birth in labor, being pushed out of a hospital, I cannot imagine the trauma she felt. Because there's a lot of pain going on. There's a lot going on in giving birth. And they just put her out like she wasn't a human being. So we could talk about systemic racism. We could talk about these studies. We could talk about other things. But I think at the end, it's about maybe us creating the safe spaces for our black mothers. And in this week, we got to, again, remind our colleagues in putting the faces and the images of these beautiful, beautiful women. Many of them did become mothers, but were not there to be able to raise their children. I hope they see these images because I see them pausing. They have no idea what it is. And when they go up there, it's in our honor portraits. And in her honor portraits, the people pause and they look at it. And I'm glad because they need to know that's why we're posting this image. This person is no longer among us. This person died because we did nothing in this chamber behind us to save the lives of mothers, our black mothers across the country. So we got to believe black mamas, got to believe black women. We got to continue to again push forward and say, look, we love the work that many, especially survivors a black maternal health crisis. Charles is many folks that I've heard testify, and you did such a phenomenal job one year. I mean, I brought to tears because you can see how helpless he felt. I felt it. And what brought me to tears is he still felt guilty. He still felt this tremendous guilt that he couldn't save the mother of his child. And one of the things that I think comes from all of this, and as we come together, is that we can't just let people look away and say this happened, and the stories that come from Illinois and really across the country, we got to make sure we're telling them every single day, even beyond this week. So I just can't thank you enough, Robin Kelly, to bringing us together. And the Congressional Mamas Caucus is going to continue to speak about Black maternal health throughout the year and throughout moments, because when they want to talk about health care, they better be talking about Black maternal health as well. And so with that, I really want to have my wonderful colleague, Congresswoman Jennifer McClellan. I always say it right. McClellan, I got you, girl. They say, Ms. McClellan, I know, you're just my Jennifer. And I know she has a story of her own. Really powerful. You guys know I know a lot about everybody, especially when it talks about giving birth. Thank you so much again, Robin, for bringing us together on this important issue. And thank you, Charles, for always being willing to tell your story.
Thank you. Thank you, Congresswoman Talib. Thank you to Congresswoman Kelly for convening us here. I am Congresswoman Jennifer McClellan from Virginia, and 11 years ago this month, I almost became the statistic of a Black woman who is 3 times more likely to die from a childbirth-related death when 9 weeks before my due date, my placenta ruptured. My daughter and I both died when she was born by emergency C-section. She will turn 11 in 2 weeks. We were one of the lucky ones. I had placenta previa, and I was lucky enough to have health insurance that allowed me to get the prenatal and postnatal care that I needed, that allowed us to cover her stay in the NICU. But too many mothers and infants are not so lucky. Compared to other high-income countries, the United States still has the highest rate of maternal deaths. And in 2023, which is the most recent year that we have data available, the national maternal mortality rate actually declined. But Black women are still more than 3 times as likely as white women to experience a pregnancy-related death. And over 80% of those deaths are preventable. In Virginia, which I represent, the maternal mortality rate actually got worse for everybody. And we face a complex road ahead as we seek solutions to protect Black women and families against this loss. The maternal health crisis connects health care with insurance policy, reproductive rights, environmental policy, and so much more. These issues don't exist in a vacuum, many of them rooted in decades, in some cases centuries, of inequity, and require a holistic approach to bring down these mortality rates and save lives. But the bad news is that recent rollbacks here at the federal level, thanks to the Trump administration and congressional Republicans in the Supreme Court, has led to a deepening of this crisis. Medicaid cuts and the expiration of the enhanced premium tax credits under the Affordable Care Act have driven up the cost of maternal care for millions of Americans, making this vital health care inaccessible for too many people, particularly Black families. The Supreme Court's decision overturning Roe v. Wade has caused 1 in 3 women in this country to live in states with abortion bans or extreme restrictions, and in those states, women are twice as likely to die of pregnancy-related causes. We have seen that in the tragic stories of Amber Thurman, Candy Miller, and many more who died while suffering miscarriages because they were not given the health care they needed, because the hospital was concerned they would violate a ban, didn't know if they were close enough to death to treat them under the law. And the Trump administration has doubled down on making it harder to secure justice for Black families and address this maternal health crisis through its executive order eliminating DEI, limiting the federal government's ability to enforce hospital accountability and treatment for Black mothers. The Trump administration's funding cuts and mass layoffs have left agencies like the Health and Human Services without the resources or staff needed to conduct research, implement policies that save lives, and the thousands of data sets that have helped us even track and determine maternal mortality factors are now gone. The Trump administration wants to go even further with a proposed budget that calls for over $800 million in cuts to maternal and child health care programs at HHS, eliminating the very programs necessary to track and address the Black maternal health crisis. We deserve better. In the face of these setbacks, my colleagues behind me and I, whether it's through the Congressional Black Caucus, the Black Maternal Health Caucus, the Mama's Caucus, any caucus other than the Republican caucus apparently. We are fighting back while we continue to push forward through the Momnibus Act, a list of 14 bills that would help us address this crisis. Our faith is in the system, but the system has failed us too often. And on Black Maternal Health Week, the 10th annual Black Maternal Health Week, we want this to be the last one where we say a Black woman is more than 3 times likely to die in childbirth. Not one death more, and we will not rest until we reach that moment. It is now my pleasure to introduce Joy Calloway, President and CEO of Black Women's Health Imperative.
I am unexpectedly full, not only because of your story, thank you for sharing, and Congresswoman McClellan for her story. I am struck that 29 years this fall, I could have been a statistic in this same system that we're talking about, and so I am incredibly moved. For more than 40 years, the Black Women's Health Imperative has stood with Black women and girls, all 21 million of us, through health crises, policy battles, and the moments when the system fell short. We are not new to this work, and we are not going anywhere. We do this work because the women who came before us demanded better, and the daughters that come ahead of us deserve better. This is not just a talking point today. This is our reason for being, our raison d'etre. It is the foundation of everything we do, from the communities that we serve to the halls we are standing in front of right now. Black women are still dying at rates that are unacceptable and preventable. It's not that we can't fix these issues. It's that we have to get society to understand that Black women's lives matter, and especially in this very critical time. Our maternal health policy priorities are clear. We are fighting for access to high quality, affordable maternal health care across the full life spectrum. We are asking for a strong and diverse perinatal workforce and chronic disease and management and prevention before, during, and after pregnancy. A healthy pregnancy does not just start at conception. It starts with a girl who has been well cared for throughout her life and becomes a woman who is now ready for this massive and important task. This is exactly why the Black Women's Health Imperative proudly supports the Care of Moms Act and the Wells Act. And we salute Congresswoman Robin Kelly for 13 years of being forceful and fierce and focused on Black women and girls and the health of this country. We want to make sure that we focus on the fact that these bills reflect the kind of comprehensive, equity-centered approach that our policy pillar is built on. They address quality, continuity, and care in ways that will save lives. This moment, the moment a Black woman becomes a mother should never be the most dangerous moment of her life. We want Black mothers to feel safe. We want them to feel seen. We want them to come home to their babies. That is the world we are building. All of us standing here are building, and we are not building it alone. We are doing this work alongside members of Congress, alongside community organizations, healthcare providers, advocates, and everyday people who refuse to accept the status quo. We are grateful to be in this moment with each of you because Black women's health is imperative. I welcome to the stage Kay Matthews, my sister in this work with Shades of Blue.
Good afternoon, and thank you, Representative Kelly, for bringing attention to a crisis that Black women and Black families have been living with for far too long. My name is Kay Matthews, and I am the Executive Director and founder of the Shades of Blue Project. I founded this organization. I'm not just an advocate, but I come today standing here as a mother. As a mother who experienced stillbirth, my hospital experience was the first time I truly understood what it meant to be a Black woman in America and to be dismissed and overlooked when it came to the most basic care that I needed. I was sent home with only the clothes I arrived in and a discharge paperwork. The journey to save myself began in that moment, and no one should ever experience that. The biggest challenges we still have to overcome in Black maternal health is that Black women are too often not heard, not believed, and not cared for with urgency. We are still navigating systems that respond to our pain too slowly, too casually, or not at all. And when we talk about maternal health, we must be clear. Maternal health also is inclusive of mental health. Too many Black mothers are expected to survive pregnancy, survive birth, survive loss, trauma, and then carry on as if nothing has happened. Too many of us are sit home with pain that goes untreated, grief that goes unnamed, and depression or anxiety that is dismissed instead of cared for. We cannot continue to treat the postpartum care as though it ends after a single visit. We cannot continue to define success as simply leaving the hospital alive. A mother can survive and still be suffering. A mother can look strong and still be in crisis. So the solution must go beyond this awareness week. We need culturally responsive care. We need policy that centers the lived experience. We need screening that leads to real treatment. We need investments in community-based organizations that Black women already trust. And we need systems that acknowledge, respect, and support Black mothers and birthing people at every stage of care. Black mothers deserve more than survival. We deserve dignity. We deserve support. We deserve to be seen, heard, and fully cared for. Thank you. Up next is Nikisha Ogletree.
Good afternoon. Thank you all for being here, and thank you to Representative Kelly for bringing us together today in honor of Black Maternal Health Week. My name is Nikisha Ogletree, and I am the mother of 4 and the Chief Operating Officer for the Association of Maternal and Child Health, or AMCHIP for short. Since being founded in 1950, we strive to advance the health of women, children, youth, families, and communities by strengthening governmental public health and genuinely deepening community partnerships. Many of us are aware of the stark statistics that plague the health of our country's families. For instance, more women die from pregnancy-related complications in the United States than in any other developed country. And data shows that 87% of pregnancy-related deaths were determined to be preventable. In other words, with the right resources, tools, and knowledge, 87% of those mothers could still be with their children and families today. This has to change. Through my 10 years of AMCHIP, I know that there is not one singular policy solution that will solve the crisis of maternal mortality or morbidity overnight, but I've seen the collective power and positive impact that federally supported MCH programs can have on mothers across the country. For instance, the Title V MCH Services Block Grant is a cost-effective and flexible funding source that addresses the most critical, pressing, and unique needs of MCH populations. In fiscal year 2024, Title V served 99% of infants, 92% of black pregnant women, and 62% of children nationwide. In my home state of Maryland, Title V funds are critical to the ability of MCH populations to thrive. For example, because Title V provides care coordination services for pregnant and postpartum women, one client whose infant was born with a cleft palate was able to be connected early on with lactation support and educational resources. These are critical early intervention services that helped both mom and baby thrive together. It's stories like these that inspire me day in and day out to continue working on behalf of moms and babies across the country. AMCHIP is honored to partner with the many champions that stand with me here today to ensure maternal and child health programs get sustained, increased investments to best serve the nation's mothers, children's, families, now and into the future. Now it is my honor to introduce Dr. McClellan.
Good afternoon. My name's Anita McClellan. I'm an OBGYN here at GW and soon to be mother of 3, and I'm representing the American College of Obstetrics and Gynecologists. We at ACOG are a proud sponsor of Black Maternal Health Week, and I am pleased to be here to represent our organization at this powerful event. I would also like to thank all my fellow speakers and acknowledge the leadership roles of Representative Robin Kelly who has been a constant ally to ACOG and a stalwart in addressing maternal health inequities in this country. We are here today during the 10th anniversary of Black Maternal Health Week to call attention to the fact that despite having made gains in combating maternal mortality overall, racial disparities in maternal health outcomes persist. This is unacceptable, and we must double down and keep working for progress. I feel like for many years as an OBGYN throughout my training and as an attending the last couple years, we have been saying the same statistics over and over and over again. And I am so tired of this performative act of acknowledging the death of our Black community and not making any impactful change that's actually making a difference for what I'm seeing in the office and every time that I'm on call. For us who are actually taking care of these patients and holding their hands, we know why they're dying. It's not rocket science that a person coming in with postpartum hypertension at risk for a preeclamptic seizure is having to choose between child care and whether or not she can stay inpatient and get the care that she needs and deserves. We know what is killing women, and we need to be less performative and more actionable in how we are actually addressing these issues. The good news is we can make progress. The recent advancement is that the Preventing Maternal Deaths Reauthorization Act, which ACOG strongly backs, is now law. That is a big deal. And this act provides critical CDC support to state-based maternal mortality review committees, and through these committees, we get the data that we need to understand the gaps in maternal mortality and provide targeted information that saves lives. So thank you to our congressional champions, many of whom are here today, who have helped in its passage, but I challenge us to not to be aggressive, and once we discover these gaps in maternal mortality, that we are very intentional about how we're going to address them and not wait a moment longer. I look forward to continuing our partnership with all of you to advance more legislation to improve Black maternal health. Thank you so much for your time and your efforts.
Thank you, everyone. We can take any questions if there are any. No? You're free.